Blood donation is a medical procedure in which blood is drawn from a person and then injected into another who needs it, or it is used to make medication. Altruistic blood donation is a charitable option that helps save lives and keep many people with certain diseases healthy. Its importance lies in the hospital's need to perform transfusions daily. A healthy person can replenish donated blood in up to 60 days, which is why a donor can give blood every 2 months.
Blood cannot be manufactured and is not issued, so regular donations are crucial. Almost everyone between the ages of 18 and 65 can donate if they are healthy.
Donating is easy, and one of the benefits of donating blood is it provides information about our overall health, improves blood flow, helps clear triglycerides, reduces the risk of heart attacks and cardiovascular accidents, stimulates the production of new blood cells in the body, and balances iron levels in the blood. Some of the requirements to donate blood are to be between 18 and 65 years old, weigh at least 50 kilograms, and not be sick on the day of donation. Not having suffered from any transmissible disease, not using intravenous or inhaled drugs, not being pregnant or breastfeeding, not having had tattoos or piercings in the last 12 months, in the last 12 hours, not having consumed alcoholic beverages, narcotics, marijuana, or any narcotic. To make your donation as easy as possible and to avoid complications, follow these tips. Sleep well. Try to arrive well rested at your blood donation appointment. 8 hours of sleep the night before is recommended. Stay hydrated. Drink plenty of water. Before donating, drink at least 16 ounces of water for a good donation experience. Avoid high-fat foods, such as French fries or ice cream. Have your identification cards ready. Bring a form of identification with you to your donation appointment. Wear comfortable clothing. Make sure to wear a short-sleeved shirt or one that can be rolled up to your shoulder. What happens during the donation?
Registration.
You will identify yourself, show your ID,
Oh,
and provide information about the donation. Medical history and health check. You will complete a questionnaire about your health, travel history, and lifestyle to confirm your eligibility. They will also take your temperature, blood pressure, red blood cell or hemoglobin levels, and pulse. For the donation, you will be seated in a comfortable position while they clean and sterilize your arm. You will remain seated while blood is drawn from your arm. Once the donation is finished, a bandage will be applied. A full bag of blood is up to 500 milliliters. Snack and recovery. You will enjoy a light snack and a drink while you wait for 10 to 15 minutes, then get up and return to your activity.
Ways to donate blood.
Whole blood or one of its components collected from a donor. An adult has between 5 and 7 units of blood in their body.
Whole blood donation. This involves the extraction of whole blood with all its components. It is a simple procedure in which 450 milliliters are extracted. The extraction of this volume of blood removes about 10% of the hemoglobin circulating in the individual. Apheresis is a procedure in which blood is drawn from a donor to obtain one of its components by recombining the remaining unseparated component. Apheresis is performed using a closed, sterile device. A volume of blood is drawn by puncturing the donor's vein. The device separates the blood into its 3 components and simultaneously selects the component. To be collected, the apheresis procedure can yield red blood cells.
We created a code with the help of a digital tool, which was Python, for a safe and healthy donation. The problem we identified was to facilitate the documentation, or the paperwork required, at the moment a person donates blood, to give it more speed and readability for the patients.
User interface capturing essential data. Once we compile the code, it asks us for the following data: name, age between 18 and 65 years to be able to donate, and a weight over 50 kilos. The system uses this data to calculate the body mass index and verify if we are eligible or not to donate blood.
The system to be able to donate blood, you need to have a normal weight, which is from 18.5 to 25 kilos, over 30 kilos. Overweight is already considered. This is essential to be able to donate. The program also includes a series of questions to see if we are in good health. More than 15 questions answered with no means you are not considered a candidate to donate.
The extra function we added to the code was hospital information. It shows the hospitals that are near the community. We selected 5 health centers and added the phone number and hours so that people who want to donate blood find it easier to go to these medical centers. At the end of the series of questions, the code will tell you if you are eligible. If you are eligible, it is because you meet all the requirements to donate blood. If not, you completed the question limit in the text. Or if not, you also cannot donate due to age, weight, or clear risk conditions. This helps you to get a medical checkup.
What is blood donation?
Blood donation is a voluntary, altruistic, and safe act through which a person gives a quantity of blood, or one of its components, such as plasma or platelets, to help save lives. This blood is used in hospitals to care for patients who need it due to accidents and emergencies, major surgeries, childbirth complications, severe anemia, cancer, and chemotherapy treatments.
Such as?
Being 18 to 65 years old and weighing more than 50 kilos. Being healthy without infections or active diseases. Fasting for 4 hours without fat. No alcohol for 48 hours and no smoking 2 hours before. Present official identification. No tattoos or piercings in the last 12 months.
Conditions that permanently prevent donation include poorly controlled diabetes, hepatitis B or C, HIV, AIDS, severe heart diseases.
Thank you for watching the video about blood donation. One blood donation can save up to 3 lives. The donation process takes between 25 and 40 minutes, and men can donate every 3 months and women every 4 months. This is because women are on their period and lose iron. Well, this happens because the female body needs a little more time to replenish its iron stores and prevent anemia. It is a process to keep women safe.
The graph shows the states that have donated the most blood between 2021 and 2024. Mexico City leads the list with 30%, reflecting greater participation and more active campaigns. Followed by Jalisco with 25%, Nuevo León with 23%, and Querétaro with 22%. States with good infrastructure and donation programs. Aguascalientes 20% and Guanajuato 18%. They show solid levels, although slightly lower. In general, these states stand out because they have more accessibility to blood banks, a stronger culture of voluntary donation, and constant campaigns. The image highlights that these places have been the national leaders in donations over the last 4 years.
During the last 4 years, these were the states that donated the least blood. Guerrero, with 8%, 8 donations per 1,000 inhabitants, Oaxaca, with 9 donations per 1,000 inhabitants, and Chiapas, with 10 donations per 1,000 inhabitants. This was due to the lack of infrastructure, trained personnel, or hospitals with good architecture. Types of donations donated each year. In 2021, the positive aspect was a large amount at 35%, while in 2024, it was 45% up. This was due to the validation of the years because the pandemic emerged in 2021, so the amounts have been increasing up to the present.